On this edition of the Maximize Your Medicare Weekly, two things. Number one, job losses, coronavirus, and health insurance, the devastating effect that it's having on people everywhere. Second, I'm so sure that I can teach you financial fluency. I start with an 11-year-old. Let's go. So a couple of weeks ago, this came across my desk, and I wanted to just review it with you because this is a pretty important article because it gives you some insight on the incredible ripple effects of coronavirus, unemployment, and health insurance. So what's happened here is, as many people know, we have catastrophic job losses, catastrophic. U6, which is actually really what I use when I think about, the level of unemployment. U6 is the official title. And this is the participation rate of people who are adult age, who are working age and are not employed. And this number is actually like 18.8%. It is not the numbers that, that are reported officially, like on Friday, the first Friday of every month. It's actually the people, because that includes the people who have also stopped looking for jobs, in addition to the ones who are newly unemployed. That number, when you add it up, 18.8%. Anyway, so by background, this is an article in the Commonwealth Fund. And for those people who don't know, the Commonwealth Fund and one other, which is Kaiser Family Foundation, these are the top two think tanks regarding health insurance and the population that I can find in the United States. It really gets no better than these two. And the reason is that they have tons of resources to do research. And very importantly, and near to my heart, as people, who have followed me know, they leave their politics at the doorstep. To the greatest degree possible, they do, right? They try to report facts. Now, can they do that entirely 100%? No, but no one can. But let's just leave it there and let's just go on to their findings here on this article. So the first one here is that up here on your screen, which is that in working households, 1 of 5 reported they or their spouse were laid off or furloughed from their job because of COVID-19. Okay, this is kind of known, 1 out of 5. And that's more consistent with my 18.8%. That's kind of why I brought it up. So this is a stunning number, but still largely known, right? And so that's not too bad. Now, there are some other ones, though, here that start to talk about how many people lost their health insurance, right? So let's continue on. And here's the one. 1 out of 5 who said they had a spouse or partner had coverage through a job affected by COVID-19 reported that at least one of them is now uninsured. So of all the people who are newly uninsured, 1 out of 5 lost their coverage. Okay. So now this has been a problem. People have known it. So what has happened is if you lost your job, then you could have enrolled in the marketplace, the health insurance marketplace. You would have had the unrestricted right to purchase health insurance at that time because that was a life qualifying event. Again, this is no problem. Now, I had proposed, or, privately, I've been saying, look, shouldn't we be having this for everyone at a second bite of the apple? We've had so much government intervention and assistance, financial assistance. This one wouldn't even show up on the radar. But under the current construct, the way that the Affordable Care Act would have worked out, that if we had just opened the window through the entire country, that would have been very, very helpful. And in fact, certain states have done that, right? They had limited windows where you could, if you lost your job, and even if you didn't lose your job, they reopened their health insurance enrollment window for private people. Not Medicare, but for private people. Okay? To me, that among the very, very long list of government assistance programs, they could have done without really not too much effect. Now, would this been super popular with the health insurance carriers? No, it wouldn't have been super popular with them. That flip side is that the usage of health insurance, the usage of people's health insurance, because they're not going to the doctor for, the hiccups. The number, and this is why hospitals and primary care physicians are having such a problem, right? Because anything elective, anything close, those things are being put off. That service is being put off. So health insurance companies are getting more, right? Because they're receiving benefit, they're receiving premium, and they're not having to pay out in benefits as a result of the lower usage rate. So for me, I wouldn't be overly convinced if someone said the pushback to opening the enrollment windows would have been, well, the health insurance companies would start taking a bath. Not overly persuaded. Here's the thing, though, is that, if you're talking about all of those people have lost their health insurance, okay, and you'll know that last week, for those people who have watched last week, you'll have seen that the current administration showing up here on the screen, the current administration has filed a suit to try to repeal the Affordable Care Act. Now, this is going to be a problem. This is a problem, right? This is a huge problem, one that's not getting that much attention, which is that, let's say, for example, you've lost your job or not. And now we have pandemic, COVID-19, certainly the risk of being sick, or that has come out to the front, right? People are more aware. I think that is very fair. I'm not sitting here telling you should wear a mask or not, et cetera, or go to a beach party. That's your business. But what I am saying is that, people do understand more now. I think that's safe to say, safe to conclude, that health insurance is kind of important. It can be important, especially in the age of a pandemic. Mr. Perfect, never sick, now all of a sudden, goes to the beach party, can get sick. Okay. The issue is that come January, if the Affordable Care Act is struck down, now the health insurance companies don't have the pre-existing conditions clause. Meaning that if you had COVID-19 and you didn't have any effects and you're perfectly healthy, let's just say, and you have testing for the antibody, you could have health insurance companies denying your application. For those diabetics in the world, you already know this firsthand, right? Which is that prior to the Affordable Care Act, you either couldn't get health insurance or had to go to the high risk pool, or your charge would have been, astronomically higher. And so now you can see it, that the ripple effect here of the tremendous number of people either laid off, afflicted by COVID-19, combined with the idea that the health insurance companies could deny your application due to a pre-existing condition, is an enormous issue, not receiving too much press. Now, for people here, for my watchers here, this is important for you also. It has important implications. And up here is the slide, right? Which is that, we don't know. We actually don't know certain things. We don't know exactly how companies, health insurance companies, life insurance companies are going to actually react. We don't know this for sure. Now, I have strong suspicions, right? And I've seen this in a couple of places. First, underwriting for long-term care is more difficult. In fact, when the pandemic first became, public, certain long-term care insurers, they suspended the application process entirely. So, the idea that, since there's this big unknown, there's risk to the health insurance company, the life insurance companies, right? So as a result, I think that we're going to end up having some further ripple effects of this stuff. And this is really an issue, right? Because now anything that has to do with underwriting determinations by health insurance carriers, life insurance carriers, kind of on the block. And this is a huge issue in my view, right? And this is why this slide here, right, which is, let me just click here so I can see it correctly. So what does that mean specifically for you? Well, what this means is that for people on Medicare, that can be Medigap. If you are enrolling in Medigap and it's not your open enrollment period, if you do not have guaranteed issue, if you do not have guaranteed acceptance, which is kind of a twist that crazy people write in books, there's nothing to stop the health insurance companies from denying your application. You can see the stories about the complications, ripple effects of COVID-19. So now, if you have the antibody or if you've had COVID-19 and I could deny you because you would cost me more money, that seems to be on the hook. So you can understand my point, right? Which is, and here is my thought for people on financial planning matters. If you're considering life insurance, switching from Medicare Advantage to Medigap, for example, deciding whether or not Medigap or Medicare Advantage, and you're just right on the fence, okay? I wouldn't mess around here. This is not the time to mess around. These moving things, these moving risky things, they're not in your favor, right? We've had a one-way street where everything has been in the buyer's favor. But now all of a sudden, for some reason, some other external reason beyond people's control has thrown a new variable into the mix that isn't in the buyer's favor. That's you. Last point, I'm not in the business of splitting atoms. Really, I don't try to make heroic predictions. That's not what I do. All I'm doing is attaching common sense and a knowledge about the way these carriers work. Practically speaking, you do the same, by the way. You do the same. You're the CFO of these companies. I promise you, you put yourself in their shoes, similar situation would occur. And has this happened in the past? And that's this last point here on this slide. A number of years ago, Blue Cross Blue Shield of Michigan offered a Medigap plan to those under 65 and also not age dependent. So you could be 99 and get at the same premium as the 65-year-old. They were taking a bath. So there was a deadline date. And once that deadline date approached, I was out there saying, look, you can pretty much think that this thing is going to be dead. In other words, that's going to be unavailable. And sure enough, it happened. And people were like, gee, Jay, did you have some special insight? I didn't have any special insight. All I did was I attached my knowledge of what was going on with some simple common sense. You can too. Needless to say, if you've been a follower, if you've read the book, watched other videos, you could reasonably ask me, how do I keep these things straight? How do I keep all of these terms and stuff straight? Life insurance, health insurance, Medicare, Medicare Advantage, long-term care, universal life, index universal life, deferred annuities. The reality is that there's just a few simple building blocks. Now you have to know them well, and you have to know them well from the beginning. And the reason it's important to know them well is because there's so much noise. There's so much noise, right? And you already know what I'm talking about. Advertisements. Your past experience, your friend's experience, your experience in taking care of your mother. The problem is that those can be distractions. And I'm not saying they're wrong. I'm not saying what their experience, that this or that didn't happen. I'm not saying any of that. What I am saying, though, is that it's still a distraction from the building blocks. And I'm trying to get us to focus on the building blocks. It just so happens Medicare, right, is one that affects 60 million people. But the reality is the same things that I see, the same misperceptions in Medicare, I could just cross out Medicare and put in annuities. And you know what? Same thing. Same thing. So what I did here is I created a video with my 11-year-old nephew, Oscar, right, about biases, about preconceived ideas that people have. It sets people off on the wrong foot. I'm convinced if you get on the correct foot, on the right foot, and stay there, then you can become financially fluent. That's what that video is. Oscar's 11 years old. He's not your average 11-year-old, but he's still 11. Politics haven't crossed his mind. Politics haven't crossed his ears. So as a result, he's clean from the biases. And as a result, he can get it. This edition of the Maximize Your Medicare Weekly. Please be sure to subscribe. Leave your comments, ask your questions. I'll return your message as soon as I possibly can. Thanks for watching. I'm Jay. Talk with you next time.
Medicare can seem confusing and scary, but it doesn't have to be. It's true, Medicare has complicated rules, a new language, and possible penalties. There are a dizzying number of options. The great news is that you can benefit from Medicare rules if you have unbiased expert guidance. Get your free guidance from J.O., a nationally recognized Medicare expert and author of the best-selling Maximize Your Medicare. Call the number on the screen today